People were fasting for thousands of years without knowing that this is fasting because they didn't have food.
Well, I'm not a fasting expert, but what I would suggest is maybe you can start with intermittent fasting, which is very, very popular, especially in the States. And you can even start maybe skipping breakfast or only eating between noon and 7, or eat your meals in a certain amount of time. So this might be a good way to ease in the fasting. So you could start with shorter period if you're afraid, and then you see how your body reacts to it.
First of all, I would ask what is the idea of you? Why do you want to fast? And then maybe find a way to explain that. And the second question is what are you afraid of? What is the fear that you have? And maybe with explanations and to show with examples that I could take the fear away. I would not, if still you're in doubt, and I can always explain that the best thing to do with fasting the first time, if you still are afraid, is to make a guided fasting, and that you always have a partner that can answer the questions and that can follow you. And in the end, I always say fasting is not, you don't decide to do fasting and then you have to go to the end. There's always the possibility of go out of the fasting. So there's really nothing to be afraid of. Although, of course, I take it very responsively if people talk about their anxiousness and if they're afraid, of course. I think the relation between the therapist and the person is very important. And then usually it works out very fine.
Many people are under the impression that if they're fasting, they will feel miserable, or they will miss on anything. For example, if you substitute a fasting with a holiday or with some free time, that you will actually regret it. From my own experience and from the experience I have with all the people that I personally guided through fasting, or my friends or my university colleagues, I can tell you that you actually benefit more of a fasting break than you do if you never fast, let's say for 5 years, for 10 years, or even your whole life. So what I always say is that fasting is more natural than not fasting. So people who eat 3 to 5 times a day for a consecutive 10 years are not going to feel better if they do an occasional fasting experience. So from my experience, I would just always suggest, if you fast, then you go back to your natural rhythms. You are made to fast. Your body is made to fast. Your body is not made to eat 3 to 5 meals a day without a pause. Second thing is that if you fast regularly, your body will get accustomed to fasting. So the metabolism is like a muscle, and you can train your metabolism to adapt perfectly to fasting, so that you will have a very, very positive effect very, very fast. So, for example, a person that comes to our clinic for many, many years will go into the fasting metabolism much quicker, the ketosis, than a person who doesn't fast regularly. So with every fast, your body adapts better, and you can get more out of your fasting experience. If you're scared, I can tell you that 6,000 people fast every year under our supervision. And I would say that most of them, not to say all of them, make a perfectly good experience. So if you just look at all of these people, take away your fear, and our champion has been with us 95 times. We've done a YouTube video on him, so if you want to look at that and see the positive result, that could be a good encouragement.
I think for people who are skeptical about fasting, who have concerns, the key is really to integrate a medical professional into the experience, which I think Buchinger does a really excellent job of. It is important to have professional medical supervision when you're undergoing something which is like water-only fasting, which is a relatively stressful situation for your body. So by integrating professional medical supervision, I think you really have the confidence that the experience will be safe and will be, ultimately beneficial.
For those who have never experienced fasting, I think it can be quite, a scary almost, sort of thing to put yourself through. But, I think the great thing about the Buchinger Clinic is that they incorporate really medical professionals into the fasting regimen. So at all times you're, under the care of excellent doctors and nurses. You have all the different, therapies and physicians taking care of you. So, these kinds of approaches where you're under medical management, I think is a great way to sort of delve into, the fasting experience.
People were fasting for thousands of years without knowing that this is fasting because they didn't have food. So food was more or less on summer and autumn, and they didn't have food during winter. So they were eating more in summer and autumn, and they are consuming the calories that they saved during winter. So fasting is very well known to the human body. But in the last 40 years, because of the change in the way that we live, excess of food, no exercise, obesity, a lot of compounds who are exposed to chemicals to the environment, everything was changed. So I think that fasting is a way that you can remember your cellular truth. And this is very important, and we have to incorporate this to our society. And I think when the scientific basis is increased in the last 8-9 years, because we didn't have a lot of information 10 years ago from humans, only from animals, I think that from now, in 4 to 5 years, fasting will be the new drug for metabolism.
Well, first of all, I think it's totally normal to be scared of fasting. We have been raised by everyone saying that we have to eat to survive. I think it's also within our human instincts or even the animal instincts to search for food. So it's totally normal to be a bit scared, to be nervous. We see that every time a patient comes for the first time to the clinic. But we also have to keep in mind that also fasting is very natural and should also be within our instincts. So we have to keep in mind that once we don't have food and there's maybe a day where we don't get a lunch or we don't get dinner, nothing will happen. This is also very important when raising children and they fall sick, they get ill. We often think they have to eat, but if they don't have any appetite, it's totally normal. Let the body rest and do the restorative program within the body, and then once they will feel well, they will go back to eat naturally. So it's all within our nature. We just have to rediscover it again.
If somebody is scared of fasting or is not sure if he can fast, let's say it this way, he's interested in fasting, but he's not sure, he's scared that he won't succeed and that he will suffer hunger and things like that. A lot of patients actually come with these concerns. And during my time at Buchinger, I learned first that most of those concerns are not really relative. When a person starts fasting, those concerns just diminish, just vanish, and the majority of patients are very surprised how easy they find the fasting. And this is, I think, the first thing I will tell patients who are concerned that it might be not possible for them. I mean, there are physical reasons why you shouldn't fast. For example, if you have severe illnesses that prevent you from fasting, there are definitions when you can't fast or when you shouldn't fast. For example, if you also are very underweight, it's not recommended to fast because then you actually go into hunger. But besides that, I think there are ways to take away the fear, and with the experience we have with previous patients, and usually it's possible to take away the concerns from the patients.